Hello, everyone. It's Monday, June the 15th, and we've got a lot to report today. Very unfortunately, we have to report on Friday evening we lost two more West Virginians, a 73-year-old male from Mingo County and a 78-year-old male from Berkeley County. They were our 87th and 88th deaths in West Virginia. We said it over and over, it's 88 too many. It's a terrific number when looking at other states, but if you're talking to one of these families, or you're absolutely one of the friends or loved ones of the people that we've lost, it's no terrific numbers. There is no terrific numbers. And so with all that being said, please, over and over I say, don't let these people be a statistic. Don't let these people lose their identity and all the greatness that they brought us over and over and over. These great West Virginians lived to be 73 and 78 years old. And the wisdom that they passed on to their families and everything will be treasured and kept forever. And so please, remember these people in your thoughts and prayers. Kathy and I will absolutely be doing that, and it's always difficult, but at the same time, we know that this cannonball killer of a virus is here, and we just got to some way, somehow, some way get through it. I mean, that's just it. There's no playbook, there's no magic cure yet, and so we're just going to have to deal with it as best we possibly can. I always start and read to you about the week that we're in. Today is week 8 of the West Virginia Strong, the comeback reopening plan. We have no additional reopenings for this week. We have a lot of reopenings that we've gone through in the recent weeks, but we still need to be very, very cautious. In just a few minutes, I'm going to talk to you about an outbreak in Greenbrier County, which just absolutely salutes the magnitude of the caution that we need to take. Many, many times a reporter has asked me, are you still concerned? I don't care what it is. Absolutely, I'm concerned. I'm concerned all the time. And that's really what makes us good. It's a virtue and it's a curse because the concern never leaves. There's no real rest. But you see, I really believe none of us should rest until this is over. And so anyway, there's guidances up on the board now for week 9 as it begins, the June the 22nd, and we're going to continue to do just what we've done already. Watch the numbers, stay on top of it in every way we possibly can. And we would caution you and ask you to please take heed to what we're saying, all the guidances that we've come up with over and over and over. Now, if I could talk to you about a church, Greystone Baptist Church, right in my back door where I live, and or am a lot. If I'm not here at the mansion, I'm there, and so, or I'm somewhere throughout West Virginia. But we now have, and I just got off the phone with the health people in Greenbrier County. I think there's a total now of 28 positive tests, and all of them, some way or another, for what I know, are related to that church. Now, we're also being told, and I don't want to dwell on this, but we're also being told that maybe we didn't use the level of caution there. Maybe we didn't social distance properly or properly wear masks or whatever it may be. That doesn't really matter, does it? We've got 28 positive tests in Greenbrier County, in Lewisburg, West Virginia area. Now, so what do? We run to the fire. And that's exactly what we've done all weekend. It was first reported to me that as great as the National Guard is in every way and all the greatness that they've done, that they were going to get there on Monday to decontaminate the church. I said, no. We got to do better than that. They did better than that. They got there yesterday on Sunday. We absolutely established extensive additional testing, and we're having people in that area really take advantage of that additional testing. We were already scheduled to do the minority testing there and the most vulnerable testing there, and it just so happened that, boom, this happens right on top of it. We've extended that testing through today, and absolutely, we will do whatever has to be done. We run to the fire. If you'll just step back and look at it. What did we do about visitation at the nursing homes? What did we do about testing the nursing homes or the assisted living? What did we do at Huttonsville? We're going to do the same thing here. I say it over and over and over. In this situation, with this COVID-19 stuff, that absolutely is a mega killer and mega dangerous, what we have got to do is we have got to continue to go to a knife fight with a bazooka. And that's all there is to it. When we get an issue, we want to run to the fire, and we want to run to the fire with real ammunition. We want to run to the fire and try to do any and everything we can possibly do to extinguish this potential problem. You see, odds are that a lot of these churchgoers are elderly people. Odds are, with this killer, that it is extremely, extremely dangerous. And so, if we continue to run to the fire, and I thank all those from the health departments in Greenbrier County, the health departments everywhere, the DHHR, all the people from the standpoint of the National Guard and the first responders, any and everybody that's involved in this effort to try to do any and everything we can to prevent a catastrophe happening at one of the stormy seas. We all know we're going to deal with this. We're going to continue to deal with this exact same stuff until we get a vaccine or a medicine that turns it into a common cold. Now, odds are we'll have that medicine and or vaccine maybe by the end of the year. 6 months. So 6 months, we've got to deal with this. And let's hope and pray it's faster than 6 months. But 6 months, we know we're going to have these things happen. And all of us have got to be prepared. All of us, all the way down through the medical community in every way, all of us from government, all of us from the National Guard, all of us have got to be ready. And then when something happens, we run. And we try in every way we possibly can to take care of it. There's additional testing that's going on right now in Greenbrier County. And I think, whether it be at Dory Miller or wherever it may be, there's, right there it is up on the website and everything. Take advantage. Take advantage. If you have any level of anxiety, concern, go get a test. I mean, it will just give us more information. It'll help us to be able to attack the situation and do it even better. Now, last night, I want to go to something else. Last night, we had some terrific rainfall. We all know we live in a state that's got mountains, and the degree of slope of those mountains is significant. And when we get rain, that rain comes off of those mountains. And if we get a considerable amount of rain, we got a problem. That's all there is to it. Last night, I declared a state of emergency for Fayette County due to the heavy rainfall this weekend that caused significant local flooding. The storm carried with it large amounts of hail and lightning, along with excessive amounts of rain that caused flooding to Oak Hill, Minden, Scarborough, and Whipple, and in the different areas of Fayette County. Multiple businesses and homes have been inundated with floodwaters. The swift water rescue teams from Oak Hill and the surrounding departments were performing water rescues in the Minden area. Warm Hands and Warm Hearts in Oak Hill is operational as a shelter for evacuees of the impacted areas. The American Red Cross, VOAD, are at the Emergency Operations Center this morning, working to make sure all those requesting assistance are taken care of. The West Virginia Department of Highways had crews out last night, or yesterday and overnight. There is damage to one bridge approach on the Old Minden Road, and several roads have significant shoulder and ditch and embankment erosion and all kinds of stuff like that that's blocked by debris. The DOH crews, the Department of Highways crews, anticipate having access for all residents to get to their homes this morning, but some will be by alternate routes or routes, and complete repairs will take approximately a week and a half to do, and crews have been dispatched and they're working on it, and they're working extended hours. Again, no one has reported a casualty. No one has reported, any loss of life to me and everything. But please, as these people, have had to evacuate homes, and they've got water damage and flood damage, and maybe even other, issues in regard to their health and everything. Please join Kathy and I and keep them in your thoughts and prayers as well. Okay, and I'm going to go through this pretty quick. We still have our cities and counties. We're looking for more and more people to apply for these CARES Act dollars. We have now sent out $6.3 million as of today, have gone out to the cities and counties. I reported $2.6 million on Friday. Now there's even a bunch more. I promised you there'd be millions and millions of dollars going out. Please continue to apply, and as we can process applications and fit you into the guidelines, the federal guidelines or whatever, we'll get the dollars out to you. I think that's working really well, and we just want to continue to encourage our counties and our cities to apply. In regard to testing, we're still looking for more and more tests with our minorities community and with the vulnerable in West Virginia. So we're testing today until 4 p.m. in Greenbrier County. We've been testing there since, I guess, on Saturday. Maybe Friday, Saturday, and I think we tested there as well yesterday. But on Friday and Saturday, June the 19th and 20th, we're going to be in Ohio, Putnam, and Wood counties, and all this, again, is optional. It's free. It's absolutely painless. For crying out loud, just go and get the test. If you have any level of concern, it'll help us. It surely will ease your tensions and everything, and so do that, please. Our summer feeding map project with 670 sites is continuing to move along and everything. If you don't have a site near you or you need assistance, call 211. That's not 911. That's 211, and we'll have people that will be able to assist you. And I want to encourage all that can do so to continue to donate to our food banks. The more and more we have, the more we can give away. So if you're in a situation in life where you can donate to our food banks, please do so. I want to give you a jail update. This is an update on our enhanced testing incentive that we put in for all the correctional facilities. There are a total of 12 active cases, COVID-19 cases, in 5 jails and 2 prisons. This is up from 9 cases on Friday. The enhanced testing results are posted on our COVID-19 website. So all that's gone phenomenally well. I congratulate all those that were involved in this effort to get everybody tested by June 12th, and we pulled it off, and so I congratulate you, and we're just going to continue to move forward on that. And the last thing I have is to remind you again about the census. I'm not going to stop reminding you. I hope we'll have team leaders that are adopt a street, adopt a community, call everybody, get them counted, It will really help West Virginia. It helps all of us. And the last thing I'm going to go to is our charts. I do this, all the time. And if you'll see up at the top, if you'll go back to when the lines were just right together, that was the beginning of May. And now in the middle of June, you see we're getting wider and wider with more recovered cases. We have 1,585 people that have recovered up on the top and 625 active cases that we're working on the bottom. In the middle line, the next line, you'll see that yesterday we had a total percent positive of less than 1%. It was 0.64 of 1% yesterday. That brought our cumulative average to a new record for us. We keep setting record after record. That's great. That's great stuff. And now we're at 1.74. In West Virginia, you are doing one whale of a job, period. That's all there is to it. Last thing I got to say. And come back to me, Jordan, please. The last thing I got to say is this. I just said, West Virginia, you are doing one whale of a job, didn't I? That's exactly what I said. Now, I'm telling you, within a rock's throw of my house in Lewisburg, we have an outbreak, and we have concern like you can't imagine in that community right now. How many communities do we have like this in West Virginia? They're everywhere. They're all over the place. And absolutely, this could be your community tomorrow. This could be your church tomorrow. This could be your family tomorrow. I know of a situation in Wyoming County where we had a person that went out of state and came back, and lo and behold, before you know it, everybody in the family's got this. Now, you got to be careful. You absolutely have to be smart. Absolutely, West Virginia. I want to be able to continue to report to you every day or every other day or however much that I'm here of just how great you're doing. I don't want to come in here and report to you of catastrophes and everything else. You are in charge, not me. I've told you what you have to do. Now you have got to do it. You have been so smart and so brilliant and such a miracle to the world so far because you've protected yourself and you listened and you did really good. Now, West Virginia, come on. You're setting records, but yet we still have communities that are scared to death and everything because something bad's going on. It can happen anywhere, at any time. This disease is still right here with us. We're going to continue to try to reopen and do everything we possibly can to get your life back as close to normal as we can. The last thing I'll say is just this. What happens? What happens if we lose a couple people, or maybe more, that are in a community, and maybe we could have done more. We could have maybe worn our masks better, or we could have been social distance, or we could have maybe stayed at home if you were real elderly or whatever it may be. We could have maybe done more, and yet we lose somebody. Because of an inconvenience of wearing a mask or whatever it may be, we lose somebody. It's a big price to pay. So please, West Virginia, please listen to me. We can still reopen. We can still enjoy our families. We can enjoy fun. We can enjoy church. We can enjoy all the things in life, even if it is a little inconvenience, and be safe. It's not much of a price to pay until we get to that drug, and we'll get there. But right now, we aren't there. Please be careful, West Virginia. Please. Thank you.
All right, thank you, Governor. Let's first go to Major General Hoyer with the West Virginia National Guard.
Good morning. Very busy weekend. We supported testing lanes in 5 counties and at our air base at Martinsburg. And as the governor mentioned, provided additional testing in Greenbrier County and a sanitization mission as part of a rapid response to the issues in the county. This week we'll be busy as well. We'll finish the last 2 groups of Challenge Academy cadets who will do their educational testing and attempt to get their high school diploma. Should have 109 cadets who will finish testing, and we hope to have exceptionally positive results from those in the next 10 to 14 days. Also this week, exceptionally busy with sanitization missions to include a major effort at Huttonsville. We will support cleaning 9 buildings across that campus, 1 million cubic square feet, approximately 480 man hours needed to do that to help address the outbreak that occurred there. Also, I'd like to thank the many folks out this weekend. I saw a lot of folks who were following the guidance and wearing masks to include a number of different events. And on behalf of all the guardsmen, as the governor said, we greatly appreciate the efforts that people are taking to mitigate the spread. And last, I would like to also thank the folks at the Division of Highways, VOAD, and the Red Cross for the great response going on to the people in Fayette County with the flash flooding. Thank you.
Thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Good morning. I very much would love to reinforce what the governor has asked of all of our citizens in West Virginia as we look at this weekend and we look at the weekends and the weeks that are upcoming. It is really important for us to reflect on the things that we know are important in protecting ourselves and protecting our state in this coronavirus pandemic. We talked last week about the 3 C's that to be careful about, which is closed spaces, in other words, being indoors, constant contacts, people that you don't live with who you are next to, and crowds. And so as we think about gathering places, whether they're churches or stores or restaurants, then we know that the more we're inside with each other, the higher risk we have to transfer the virus. And as we've also said, there are a few people that can become infected, and even before they know that they are infected, they can infect many other people. And remember the choir practice in Washington State, where one person infected, I believe, 56 of 62 people at that one choir practice. So as we are starting to gather, and we love that people are coming together to celebrate and to give thanks in their own way, in their own church and denomination, or go to other of our great businesses, then when you will be around other people and when you will have trouble distancing, or where you will be in crowds, inside or outside, then we really, really encourage people to wear masks, to try to stay that distance. We know that staying 6 feet of distance away from each other is protective on its own, and when combined with wearing face masks, if 80% of people do that, we get a significant benefit that protects not only you from getting infected from other people, but importantly protects other people from getting infected from you. We know that our R0 value has risen a little bit, which is probably reflective of the data the governor communicated to you earlier. But this is really such an important issue. There was just an article about Denmark, or about Sweden, that came out from Thomas Puyo. I did post that online, and it talks about Sweden's strategy to try to carefully let people be out, no face mask, no protection. And they now have more cases than every other country in the Netherlands combined, and 21 countries in the European Union all combined. And their death rate is 11 times Denmark's, and is the highest now in the Netherlands area, and I believe the highest in Europe. So it's really important that we do the right things that have helped us do so well so far. And we know that you, West Virginia, will continue to answer that opportunity to protect yourselves and your neighbors and help us remain the beacon for others. So thank you so much.
Thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good morning, everyone. I have one quick announcement. In April, Governor Justice and DHHR announced a free smartphone app to reduce isolation and offer support resources to West Virginians with substance use disorder. The Connections app from Chess Health is an engaging, evidence-based solution proven to improve treatment and long-term recovery outcomes for individuals with substance use disorder. At the time, the Connections app was only available to patients connected to treatment providers. Today, we're pleased to announce that the Connections app is now accessible by individuals in recovery who are no longer affiliated with a provider but still need those resources. Chess Health and DHHR have partnered with First Choice Health Systems to provide support services and linkage to care for individuals who reach out for help on the app. For more information about how to access the Connections app, visit helpandhopewv.org. That is helpandhopewv.org. That should be on the screen now. So that's all I have. Thank you very much.
Thank you, Secretary. And finally, to Dr. Kathy Slimp, our State Health Officer.
Good morning. I think, want to just reiterate some of what we've mentioned earlier and talk about a little bit about the fact that we keep getting this question of, is it safe to do this or safe to do that? And it really isn't just a matter of safe or not safe. It is really about managing risk. And that really takes intentional action by all of us. To very briefly touch base on the outbreaks that we've been seeing, they've been much more community-based rather than facility-based recently. So we're at a different stage where we are. And if we look across those 5 outbreaks, there's been a total of 53 individuals who attended services that have been infected. We realized that those individuals have contacts elsewhere in the community as well. So there's been an additional 26 across the state that have been infected subsequently, family members, friends. So I think we have to really recognize the importance of the work that we all do. And what we learned across these and how we move forward is what's most important. So I think there's been 3 key lessons that they are pointing out to us. First is that the prevention measures we're all talking about work. We really are not seeing these outbreaks in churches where people sit in family units or space themselves every other pew or hold the services outside or wear masks and avoid singing while they're collectively together or do good environmental cleaning. They really make a difference in the efforts that we undertake. So I think that first thing that we can all learn from things is that when we put these practices in place, they work. The second one has been being careful about out-of-state travel. We know that when we go out of state and we're in contact with others, especially if they're sick there, we can bring that back. So it's important to be careful when we return home and that we how we manage our contacts when we return home that next couple of weeks when we're back in state. And then the third one is, if you're sick, please stay home. We continue to hear situations in which people go to work sick or go to church sick, and it's just really easy to spread disease that way. So regardless of what you have, if you are sick and something that you feel is infectious, please stay home. And especially if you do have to go out, wear a mask and continue to do that all the time, because that's really what protects each other. This really is about not just taking care of ourselves, but protecting each other. It's about using our heads, having a little bit of discipline, and moving forward in ways that be a little bit inconvenient. But it really is about keeping our state safe. So thank you for doing that. So many folks are doing that well, and we really appreciate it. We just all need to make sure we do that together. Thanks.
Thank you, Dr. Slimp. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Kenny Bass with WCHS and Fox 11.
Hi, good Monday to everyone. And hello, Landon, if you're watching, by the way. I have a question for Dr. Marsh. And you've talked quite a bit about the dance in the articles that I've read. I've also become familiar with that terminology. With what's going on in Greenbrier County, even though it can be mitigated and it can be dealt with good sanitary controls and mask wearing, etc., are instances like this just something that we're going to have to get used to unless and until we have a vaccine or some type of medication, because this virus is so shareable, for lack of a better term, that this is now a part of our new normal. This is going to keep happening. Thank you.
Governor, you want to start? You want me to?
No, Clay, go ahead, sir.
So Kenny, thank you for that really very insightful question. So I think that we certainly, as you said, this is Thomas Puyo's vernacular about the dance that we're in now, which is learning to live and navigate the COVID-19, the novel coronavirus. And I think it really is a bit of both. So ultimately, we know that this virus is everywhere. It's a pandemic. It's very infectious. We've talked a lot about how people, before they get a lot of symptoms and before they even know that they're sick, can a certain subgroup of people infected can infect a lot of other people. So I do think that it is very likely, and I would even say impossible, to think that we could eradicate all of the coronavirus spread, no matter how good we are at implementing the techniques that we've articulated. On the other hand, we know that countries like New Zealand, that's done a really good job with having their populace really buy into what the prime minister there has articulated. They've also been very careful about their influx of people into New Zealand. We've talked a lot about Hong Kong, that still has had less than 10 deaths from COVID-19. Japan, that's had less than 1,000 deaths and a 2% population adjusted risk of dying from coronavirus there than it would be in the US. So ultimately, we know that we can make a huge indent and live in some harmony with COVID-19 if we do the things that the governor's talked about, that Commissioner Slimp just talked about, that I've talked about, that many authorities do. But that really does require not only cultural change, which is very difficult, but also a constant sort of perspective and understanding that by doing these things, and I think this is a really important point that many people don't really think about, by wearing a mask, by physically distancing, by washing your hands, by being careful, you're really using that as a show for you of altruism, of love, of community, because it's you that are protecting others from you as much as you're protecting yourself from others. So, and that's really why it's so important for all of us to consider doing these things that we know protects other people in environments that we're in, like in church, like with people who are vulnerable. And we want people to enjoy all the privileges that we do, that our country is able to provide for us and our state is able to provide for us, but do it safely. So I think that during this time, Kenny, as you said, before we have a vaccine or a drug, it's going to be really important for us to be constantly reminded, hopefully not because of bad outcomes, but because we take it on ourselves and in our hearts to do the things to protect others, to protect our communities, to protect West Virginia, and to continue to make West Virginia the place that other people look to.
Thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you just said that you believe that we're 6 months away from a vaccine. Could you talk about what you're basing that information on? And then could Dr. Marsh weigh in on the accuracy of that? What are we basing that sort of projection on?
Well, Charles, what I'm basing it on is just this. You know, there are so many reports that you read, and there's so many people that you talk to. Over the weekend, I spent a lot of time, talking to the head cardiologist at Johns Hopkins, and in our discussions, we discussed all kinds of different things that were possibilities that were out there on the horizon. If you listen to the federal government and you listen to the media and you listen and you read and everything, then you develop a feel for things. There are situations to where now, believe it or not, there are people that are volunteering to become infected with COVID-19 in order to be able to test a potential vaccine. Now, and I got this yesterday. I didn't know it at all, but the gentleman, who's a great friend, he came down. We spent some hours together and everything just discussing this. Believe it or not, there was my daughter and myself and him that were in the discussion. The entire time that we were in discussions with one another and everything, we wore masks and everything. So I encourage people over and over and over just to think about that, just to think what I'm trying to do. Now, with all that, one of the things he reported to me is he said there's a study going on right now to where people are basically volunteering to become infected with COVID and then take a potential, life-curing vaccine and everything. Well, naturally, the people that are going to volunteer are your younger people, because surely to goodness not older people are going to, volunteer to be infected. But there's so much going on across this nation right now, let alone the world and everything, to try to come up with basically a miracle vaccine, and we will. It's just a matter that everybody's trying to short hop all the process of all the testing and everything that we'll have to do with there. But the bottom line of the whole thing is none of us know. None of us know. All we can best do is predict. But I really feel like that we will have either a drug that will turn this thing into a common cold, or we'll have a vaccine by year end, or sometime very, very close after that.
All right, thank you, Charles. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi all, it's Taylor with the Herald-Dispatch. I was wondering from the health officials about hospitalizations. Now that elective procedures and other things are opening back up, how do we monitor if we have enough beds and like ICUs and things again? And what is the protocol for ensuring that hospitals are prepared for a possible second wave?
I think Dr. Marsh and Secretary Krause and Dr. Schlemp, you guys answer that.
So maybe I'll start and then I'll pass the baton. So we do measure every day the hospitalization rate coming through the hospital association, the critical care bed rate, and also the ventilator bed rate. So we do keep careful track of that. We know as the hospitals have increased their activities, that there are more elective procedures and urgent procedures that are being done. And therefore, there are more people that are in hospitals today than at the nadir that we had asked the hospitals to do to open up capacity in case we had the first surge. The hospitals through that experience have really learned a lot. And by reducing and canceling elective procedures, the hospital's volumes go down very precipitously. At the same time, we are monitoring that and the increase in bed activity and capacity, how full the hospitals are, we don't believe is related to COVID, but really to reactivating a lot of those sort of elective procedures, et cetera. We also have been working with National Guard and others on starting to increase our supplies of personal protective equipment, which would be really critical in case we did have a second surge. So I believe we're in good shape for that. I believe that we are getting prepared, and I hope that, as we've talked about, that we can do the appropriate strategies that won't cause the surge to happen and continue to go as we are currently. But I'll pass the baton to Bill and to Kathy.
Sure. I think Clay has covered it well, actually. We're seeing currently that there's far fewer cases of COVID-19 in the hospital. You can look on the website, and as of today, there are 25 individuals with COVID-19 that are hospitalized, 8 in an ICU, and 2 on vents. And you will also see on that, on the dashboard, that those are trending down. Back earlier, at the beginning of May or so, that was double the rates as of that. So I think we're following that. What we also are seeing, and we do follow, as he mentioned, the fact that overall census in hospitals is going up. And it's actually quite high oftentimes, especially in ICUs and across the census. As hospitals reopen, they're catching up on surgeries and they're catching up on other things. So what's important is those facilities really have the ability to shift and flex if we start to see increasing cases. And so that I think we've all learned things from the first round that hopefully we can apply with the second round. If we see cases begin to increase with COVID, we know how to rapidly flex and free up beds and be able to prioritize again. So that's what's really important for our ability to be flexible moving forward.
Okay, thank you, Taylor. Next, we'll go to Mark Curtis with Nexstar Media.
Good morning, everyone. Mark Curtis, Nexstar Media. I have a question about the churches. I know we know which one it is in Greenbrier County, but can you tell us, apparently DHHR does not want to give out the names of the other 4 yet, but can you tell us what's being done to address the situations at the churches outside of the Greenbrier County case? And also, does this raise the question of, did we open too soon or open too fast, the fact that we have outbreaks at churches already?
Okay. Secretary Krause, you're going to have to answer this, or somebody's going to have to answer it other than me.
Sure.
All right, Kathy, go right ahead.
I'd be happy to talk to that. These are happening around the state. It's not one area. We've had church-related outbreaks in Marshall, in Boone, in Hampshire, in Jefferson, and Greenbrier, and they could happen anywhere. There's not anything unique about those settings. And it really, the thing that we look across has been the importance of adhering to those recommendations and taking precautions. This is about using the tools that we've got and loving our neighbor and protecting each other. So they really are focused on the importance of intentionally taking action together as we move forward. There's nothing magic about them. They're not telling us anything unique that we didn't know already about disease prevention in communities. It just talks about the importance of managing risk and doing that collectively.
Okay, thank you, Mark. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here, and I'm going to have to break one of the rules of this thing and ask 2 questions because there's some breaking news. First question's on the medical front. Obviously, you put in place a new method of trying to track outbreaks and spikes and surges. I did want to know just how that worked into trying to detect these outbreaks in the churches. It seems like we're detecting them at these little outbreaks kind of in small doses, which would probably be a sign that program is working, but I figured y'all could tell me. And for the governor, the U.S. Supreme Court just ruled overturning a lower court decision on that would allow the Atlantic Coast Pipeline to continue, which would be certainly good economic news for West Virginia. It could mean the restart of pipeline construction in the state. What are your thoughts on that? Thank you.
Let me, Kathy or somebody answer the first question, because I can't answer that very well, but then I'll take over after that.
Sounds great, sir. In terms of surveillance, report outbreaks in a community or any setting are actually reportable to the local health department within 24 hours of identification. So health departments are constantly on the lookout for this and identifying situations as they emerge. In addition, with COVID-19, the disease itself is reportable, so they are rapidly doing case investigation and contact tracing. So we hear about these through local health department work. We identify them through other mechanisms that come in. And then we often see, and it correlates with some of the monitoring mechanisms that we're using as well. So for instance, our instantaneous value that Dr. Marsh has spoken to, we will see an increase for a region and recognize and that it's actually due to the fact that there's an outbreak in X facility or X church. And so we look at several things that really identify those and see them come forward. So it's actually multi-factoring there.
Okay, if I could jump in here and talk about the Supreme Court reversing the decision on the pipelines, I'd say, good job, Supreme Court. That's all there is to it, you know. And good things will happen in West Virginia and lots of different places all throughout our country and everything, especially in Virginia and North Carolina. And we'll be able to we'll be able to increase gas production naturally and everything, but absolutely there'll be jobs and jobs and jobs and everything. And all I can say is one more time, good job, Supreme Court and everything. And thank goodness, you know, for the decision. And our Attorney General Morrissey just filed a brief in support, and we thank him. And good news for West Virginia.
Okay, thank you, Steve. Next, we'll go to Paul Mullen with WCBC Radio.
Good morning, Governor. Good morning, everyone. Paul Mullen here from WCBC in Cumberland, Maryland, and Kaiser, West Virginia. There has been a report out of Morgantown of protests there dealing with the chief of police of WVU having a Blue Lives Matter and also a thin blue line flag behind him as addressing a campus event of some sort, and that has spurred protest. I want your thoughts on that. Is that something that you believe is within the right of protest, and the calls that they have for defunding police at West Virginia University? What are your thoughts on that?
Well, first of all, I'm really glad that we got a question in regard to this, and the reason I'm glad is just this. You know, we don't need our country right now. There's parts of our country that are ripping apart. We can brag on how great West Virginians have done in regard to their peacefulness and effectiveness as far as their voicing of their, you know, freedom of speech and their frustrations and their protests. All that's great. But the one thing we don't want to do is just this. We don't want to sweep this under the rug and think if we don't talk about it, it's just going to, you know, go away, and the best thing is just keep quiet. And then maybe nobody will say that. That's not the thing that people should do. People that absolutely feel like that they should voice their opinion should do so. And then we ought to try to listen. And we ought to try to all come together and get better. You know, just sweeping it under the rug and hoping it'll go away, that's not what we should do. That's not what Jim Justice wants to do. Absolutely, I want things to get better. That's all there is to it. We've seen what happened to George Floyd, and we all know how bad that really is. Maybe, just maybe, throughout all of our communities, whether you are on one side of the fence or the other side of the fence, the bottom line is we can do better. We can absolutely do better. And as we do better, all of us together, as wonderful Americans, irregardless to the color of our skins, all of us together, no, irregardless to the different views that we may have, if we really address it, have it front and foremost, don't sweep it under the rug, and work at it, we'll be better. Now, as far as the situation with the Morgantown, the university policeman or the chief of police. I don't know about that situation. I've not been following that, firsthand and everything else. But the bottom line of the whole thing is this: you got people hurting. You got people that are really hurting, and you got people that are really upset, and you got this nation ripping a little bit, if not a whole lot. And absolutely, we need to let it be addressed and then work at it, and don't sweep it under a rug, and absolutely not just sit back and wait for it to go away. We should absolutely try to make things better. That's all there is to it.
Okay, thank you, Paul. Next, we'll go to Amanda Mueller with WBOY.
Thanks. Amanda Mueller with WBOY. We've talked a lot during these conferences about unemployment and especially delays in unemployment with the situation with fraud. We have had several people reach out to us in the last week. They're waiting for their payment, but they've expressed concern because they're on the verge of losing their homes or on the verge of losing their cars. Is there any resources or any way that they can get through to someone to get some help if they are in that type of situation?
Let me take it. Scott Atkins is not with us today, but let me take it as best I can and just tell you just this. Absolutely, there should be people that they should be able to talk to. If they can't get through to people at Workforce West Virginia, then I would welcome them to call our office. At the end of the day, I've said it over and over and over, and this is just all there is to it. When you have thousands of people trying to get applied, and you do not have the abilities to be able to get that through the bottleneck of the federal government or the rules or whatever it may be, and get it all pumped out tomorrow, then you have a lot of unhappy campers. Now, it doesn't matter to me that the bottleneck was tough and everything else. We need to fix it, and so at the end of the day, we put triple the workforce. That didn't work, so we put triple that workforce, and it did work. And we processed the claims. And then we got really caught up, and then we found out that we've got fraud going on, and we got people that are cheating and people that are absolutely trying to take advantage of everything, and the people are anywhere close to being eligible. They're nowhere close. And so now you've got to step back and you've got to really bear down. You've got to absolutely scrutinize everything. Now it slows the process down even more. And then you get a situation to where you have, whether it be thousands or one's too many. One's too many. If you've got somebody that's about to lose their home or about to lose their automobile because they're waiting and they're absolutely eligible, one's too many. And so absolutely tell them to call our office if they can't get through at Workforce, and just tell them to keep at it and everything. I know the people are doing all they can possibly do, but at the end of the day, my dad would have said over and over and over, I stood right in front of his desk, and this is the subscriber to this through and through. He said, he was, telling me about a situation. I said, Dad, there wasn't anything I could do. Well, about that time, the whole desk exploded as he grabbed a hold of me and said, Dadgum you. And he didn't say that, but he said, there's always something you can do, and you better dang well always remember that. Well, the net of the whole thing is that's how I live my life. I don't care that it's complicated and it's really hard. All I want to do is just get stuff done. And so absolutely tell them just please keep calling, and please continue to let their voice be heard, and we'll get there. We'll get there some way.
All right, thank you, Amanda. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, health experts. The church in Greenbrier County that had the outbreak posted this in part to social media. They said, "We adhered to the state and local governments concerning the reconvening of our church. We greatly encouraged anyone who was feeling ill to remain home. Attending church was a voluntary basis. We greatly encouraged those to wear masks and gloves if they felt more comfortable. Our church ushers were helping with proper seating and arrangements as given to us by Governor Justice. Our services did not include any time of fellowship. Is this just an example of what can happen even if to the guidelines when you have a virus that is spreading? And is there any more that can be done? And what does contact tracing tell us so far about what happened at this church? Thank you.
Okay, Brad, I got everything until the meat and potatoes of your question, and then it just kind of blurted out. Did anybody get the what his question was, the primary part of his question? I got the contract.
Governor, I just wanted to know if this is what can be expected when we have a virus that's spreading, or if anything special in addition could be done by churches. Thank you.
Well, I guess I could easily defer to the medical community. I want them to weigh in just in a second, but let me just say this. First of all, church is the most important thing in many, many ways, in lots and lots and lots of our lives. Now, I would say this too, that at church, we have said here, our medical community has warned us 1,000 times over. If there's any place where the elderly are more susceptible or come there more, we're closer together, absolutely we're singing, we're raising our voices. It is really likely for us to embrace and do the things, or maybe not wear the mask or whatever. It is absolutely a target of this killer. A target, that's all there is to it. And so now, if our medical community could jump in, as far as our contact tracing, we're working all that and everything. That was the tail end of your question, Brad. But this situation is just this. All of our churches should take heed in every way. Losing lives are not worth it. They're not worth it, to not really adhere to the strictest of guidelines. And I really don't know if this church was doing that or not. All I can tell you is stuff that the hearsay that you hear and everything. But this church may have been doing things just perfect. I spoke of a family, where somebody traveled out of state and came back and infected the whole family. This thing is not going away, and it's with us, and we've got to just really stand ready and be on our toes. But somebody else maybe from the medical experts could do better with this.
Well, let me start if I can. This is Clay. So I think that your question is very well positioned, and it does, as the governor said, underscore the real focus, the needed focus on making sure that people are there that go to church and celebrate are very cognizant that by protecting themselves, they protect each other. Singing is a particular challenge when it comes to spread of the COVID-19, as well as, people who maybe a lot of people are wearing masks, but maybe not everybody is. And I think that this is unfortunately something that we are living with, and this has been seen throughout the country and throughout the world, that these types of environments, church environments, are of concern for spreading of COVID-19. And I think it really also underscores one more thing, which is if you are a vulnerable person, if you're older, if you're African American, if you've got pre-existing health problems, then it would be very much advisable for that church service, if possible, to be broadcast or for you to experience that more virtually, because particularly until we reach a vaccine or a drug cocktail, as the governor talked about, then this is an ongoing risk for people. And while everybody needs to take all the right precautions, nothing's ever 100%. So for people that are really at risk, we would very much advise, if possible, that you participate in a virtual way as opposed to an in-person way.
All right, Governor, I'll turn it back to you.
Let me end up by just saying this. First of all, to all those in all the different churches, that have had issues, we surely have many, many, many thoughts and prayer, and encourage everybody to do so for those people, because they need your thoughts and prayers, and they need them right now. I want to go back to just two or three things. I want to say, listen to Dr. Marsh. Absolutely, he gave you an example of the country of Sweden, and he gave you an example of all the Netherlands and all the countries. He gave you an example of what's going on in Hong Kong and different places, and where it's done amazingly right and maybe amazingly wrong. And the difference is absolutely measurable. I always love the mathematics. I always love the science. The differences are absolutely measurable. So listen to that man. That man knows, and he's a superstar, as are all the rest of our medical team and everything, and listen to them. I do, and I want you to. Now, I would tell you this, if you listen to Secretary Crouch today, he gave you reports on what's going on, with this terrible drug epidemic and all kinds of different things that we're still trying to do. This train still goes on. And that's one thing that I have tried to make sure that we do. We don't drop the ball while this terrible pandemic is going on. We don't drop the ball with our economy, with different things, that go on within the state that we've continually got to look after and everything. And so DHHR, good work, and just keep at it. I want you to listen to Dr. Schlemp. Dr. Schlemp said, are we safe? Are we safe? The answer is no. She said that. If the question is, are we completely safe? The answer is no. And she just said that. All we can do is minimize the risk. That's all we're doing. This thing is with us. We can't say we're completely safe. We're not. We can't say that we don't have concerns. We do have concerns. We can minimize the risk, and that's what you're expected to do. Now, the last thing I would say to you is just this. Is there anyone out there? Is there any one of our medical experts? Is there anybody on my team, including me, that could really believe or can really believe what we're going through here? Nobody can believe it. Nobody could possibly been able to believe that we are dealing with a worldwide pandemic. Now, I am telling you how we're going to get through this. We're going to get through this exactly the way that we've gotten through it so far. And that is just this. West Virginians have stayed together. West Virginians have helped one another. West Virginians have continued all to pull the rope in the same direction. And I would tell you just this. If I stepped back from you 6 months ago and said, what do you think the probability that the Fed is going to lower the interest rate to zero? Well, you'd have said none. I would have said none. They did. What do you think the probability of oil that runs this world in many ways would have dropped to a value that it was worthless, totally worthless? There was a point in time when oil dropped so low that the price went negative and they would have to you would have had to pay somebody to take the oil. Nobody would have believed it. Nobody could possibly believe what is going on with this pandemic. Now, we can all manage it. We can get through this together. We don't need to get fractured. We absolutely have to stay together. I am telling you, every day I think of just this. Nobody could believe it. Nobody could possibly believe it. That doesn't matter. We got to deal with it. And how we deal with it is just this. We wear our mask. We stay away from one another. We absolutely be really smart in everything we try to do. We get tested. We do all the things, plus the fact that our whole community and effort is standing there ready to run to the fire. West Virginia, you've done awfully, awfully good. You are truly the miracle. Now let's some way, somehow stay at it and get through this and get us across the finish line. Thank you for all you've done in every way. And God bless each and every one of you.